Dr. Salzarulo, why do so many people with autoimmune disorders complain that they are not getting the health results they want from the conventional medical system?
Millie, that's a really great question and a really important question, and you're right. There are so many patients out there that are suffering from autoimmune disorders and they are not getting the health results that they want. So there's a few key reasons. Number one, our conventional medical system is designed to manage the condition and to give medications that help to suppress the symptoms and to decrease inflammation. It's not designed to address the underlying causes of what is driving these autoimmune diseases. Okay, so number two, whenever you have an autoimmune disease, there are always underlying triggers that are driving the autoimmunity, always. And if these underlying triggers are not identified and addressed, there will not be a healing response. You can certainly have a suppression with the medical drugs, but the body will not be set to heal. Number three, what patients need is a program that is designed for their individual needs and is also clearly written out and clearly tells them what they need to do, what foods that they need to stay away from, what foods that they can eat that are helping them to heal, what supplements that they may need to take, or homeopathic remedies, and maybe even things like sleeping or household products and other lifestyle factors. And once again, it needs to be clear to them and it needs to be written out in a way that they can clearly follow it.
You spoke about triggers. What are the triggers that are driving the autoimmunity?
Another great question. Okay, so the main triggers that I find are viruses, fungus and mold, which also includes things like Candida albicans, heavy metals and other toxins, pathogenic bacteria, and inflammatory foods. Another thing to know is that some foods can be inflammatory for one person and not inflammatory for the other person. That's why testing is so important, and the proper testing. Now, the tests, these triggers can be identified with tests. Most of them are blood tests that you can have performed at your local blood lab, and some of them are tests that you can do at home, easy tests to do at home.
In your practice, have you observed good health results with patients suffering from autoimmune disease?
Oh, yes. Many really great results. And that's because, Millie, the programs are designed in a way that we just mentioned. They're designed to identify and address the underlying causes, and then they have also a clear roadmap, which is a written program of how to do it. For instance, a woman came in several months ago, a 48-year-old woman, and she had complaints of a lot of hand complaints. She had trouble opening jars and trouble working at the computer. She was constantly in pain, felt all types of inflammation throughout her body. Now, several years ago, she had been diagnosed with an autoimmune disorder, lupus, and then she was also diagnosed with rheumatoid arthritis and Sjogren's syndrome. And you often see that once one autoimmune disorder comes on board, then sometimes a few months or years later, other autoimmune disorders show up. So gave her a program, She followed it. She was committed to the program. And of course, we gave her a lot of guidance along the way and a lot of support, because we love to inspire our clients and do whatever we can to empower them and help them stay committed and also have a clear understanding of what they're doing. And now she's off all her pain medications, and she's just really, really doing well. And that's one example of so many clients that have come to us, and we've used this holistic approach.
Dr. Salzarulo, how can someone contact you to make an appointment?
Well, the two best ways are the phone number, 212-475-2222, and also via email at drsalzarulo@gmail.com. And in closing, I'd like to say that I am always so inspired when people reach out and they want to explore a holistic path to healing, and it is our privilege at the office to serve them. And thank you for your listening.